I'm Iman from Health Legacy TV. Today I'll be reporting about super acne. It's a very common skin condition characterized by blackhead and whiteheads and pus-filled spots. It varies in severity from a few spots on the face, neck, back, and chest to a more significant problem that may cause scarring and impact on self-confidence. A degree of acne affects nearly all people between the age of 15 and 17, and in to 20% of young people, the condition is moderate to severe. Propionibacterium acne lives on everyone's skin, usually causing no problems, but in those prone to acne, the build-up of oil and ideal environment which is these bacteria can multiply. This triggers inflammation and the formation of the spots. Antibiotics are just one element that we have on offer to treat acne. There are other options, says Dr. Whitehouse. If acne is milder, you can use creams. Once the acne is under control, then you can start with the antibiotics and continue with the cream. The other thing to do is use the cream with the tablet because that reduces the chance of developing the resistance in the first place. We want to able to continue to use them, and so in order for them to be effective, we have to be responsible for how we prescribe them. There's lots of different types of antibiotics, so switching can help. After 3 years, was referred to a skin specialist who put her on a strong drug that seems to have worked. The official advice is if antibiotics don't work after 3 months, patients should be referred to a skin specialist. Delaying treatment can cause scarring. It is definitely a concern which I think both patients and doctors need to be aware of, says Dr. Weather Whitehouse. A recent study released at the British Association of Dermatologists annual conference found that on average patients were prescribed antibiotics to treat acne for 6.5 months before being referred to a skin specialist. One person was prescribed antibiotics for 7 years. Researcher Dr. Alison Lighton said it could cause the emergence of antibiotic resistant Propionibacterium acne, the bacterium implicated in acne, making acne harder to treat in some cases. Worryingly, the use of oral antibiotics is likely to drive resistance in other bacteria unrelated to acne. Acne can be treated by using antibiotics, but overdose of antibiotics can cause super acne. Super acne is incurable, could soon blight the complexion of millions of teens because doctors are overprescribing the antibiotics. Too many acne sufferers are taking them for too long, and this is saying the emergence of a bacteria that is becoming resistant to the mainstay treatment. Acne will be harder to treat, knocking the confidence of up a fifth teens whose condition which is moderate or severe. Many sufferers are being prescribed antibiotics for up to 6 months, twice the recommended limit, and one has been on it for 7 years. Doctors at a British Association of Dermatologists conference in Birmingham said overprescribing could cause the emergence of antibiotic-resistant Propionibacterium acnes. The bacterium that causes of antibiotics is also likely to drive resistance to other bacteria unrelated to acne. Under National Institute for Health and Care Excellence (NICE) guidelines, unless as improvement is seen, GPs should only continue to prescribe them for up to 3 months before a referral to a dermatologist. In cases where patients are responding to the antibiotics, then treatment should continue for 4 to 6 months alongside skin creams. An analysis of 928 patients by Dr. Alison Layton of Harrogate and District NHS Foundation Trust found average oral antibiotic use prior to referral to dermatologist was 6.5 months. The longest exposure to a single antibiotic was 84 months, equivalent to 2,520 days, a little short of 7 years. A second study by the same authors of 4,518 patients and 1,227 doctors found only a small number of GPs followed NICE guidelines. Over half said antibiotic resistance was a big problem in managing acne, but only a quarter said it was a concern for their parents. Yet, 3/4 of patients worry about antibiotic-resistant infection later in life. Researcher Dr. Heather Whitehouse said, antibiotics remain an important part of acne management, but given concerns about antibiotic resistance, we should be using antibiotic judiciously as part of treatment regime, limited to the shortest possible time period. Oral antibiotics are frequently being prescribed on their own for patients. This is not something guidelines advocate, as individually they are not effective at treating all aspects of the condition. Not to mention the fact this sort of monotherapy is implicated in driving antimicrobial resistance. From the patient perspective, the study has shown the duration of oral antibiotic use is longer than we would wish to ensure patients are receiving optimum therapy, says Dr. Heather. Matthew Guest of the British Association of Dermatologists said, as the NHS and advisory bodies get increasingly serious about the responsible use of antibiotics, it's important for doctors to reflect on how they prescribe use of antibiotics, which relies so heavily on antibiotic usage. This study provides an important warning and will hopefully help healthcare professionals and patients.
For today, I am Iman from Health Legacy TV. Thank you.